doing a modified knots test on Gypsy. Gypsy has not been on heartworm prevention. The purpose of doing the modified knots test is to concentrate and identify microfilaria. So we've got our 1 ml of anticoagulated blood on Gypsy. We are going to drop the 1 ml. In our tube. And then we are going to drop 9 cc's of saline, 2% formalin. To our tube as well. Make sure to invert it gently a couple times. And we are going to put it in our centrifuge at about 1500 RPM for 5 minutes. So we are going to take out our sample. We are going to get rid of the supernatant. You want to be careful not to disturb the pellet at the bottom. And then you are going to add a drop of the new methylene blue stain. And you're going to use your pipette to mix the two together. And then you are going to place a drop on a slide. And then you're going to put a cover slip over that. I'm going to get it focused first, and then I'm actually going to look at it under 10 times magnification. And I am not seeing anything yet. Looks like lucky for Gypsy, I do not see any microfilaria, so we're going to restart her on some heartworm prevention and recheck her test in 6 months. I'm going to be doing a fecal flotation on a puppy stool today, Rudy. His brother has some roundworms in his stool, so we are worried that Rudy may have the same thing. We typically use the fecal flotation for less dense parasite eggs like roundworms or hookworms. So we're going to take a little bit, approximately 2 grams of stool, and we are going to put it in our cup. And then we're going to take 30 cc's of our fecal solution. We're going to mix those together. We're going to use a gauze square to strain our sample into our vial. And then you're going to want to leave a little meniscus on the top. You don't want to overflow it. And then we're going to take a cover slip and place it over our vial. And we are going to set a timer for 5 minutes. Our sample has been floating for 5 minutes now. So I'm going to carefully remove my cover slip from our vial and place it on our glass slide. And now we are ready to look at this under the microscope. I'm going to be doing a direct smear on a stool sample from Taco. Taco recently spent some time at the lake and has been having diarrhea, so Dr. Mensick is concerned that he may have Giardia. Direct smears are typically used for identifying Giardia as well as bacterial overgrowth. So we've got our glass slide here. We're going to put just a little bit of stool. Saline. And you want to just basically roll it into a thin layer. And then you want to remove any of the excess stool. And then we're going to place a cover slip over. And now we are ready to look at our sample. I'm going to be doing a fecal flotation with centrifugation. This is going to be on Biscuit. Biscuit likes to frequent the dog park, and her brother actually has whipworms, so we're concerned that she may have some whipworms as well. Typically, the fecal flotation and centrifugation is a more sensitive test, and it is able to pick up the more dense eggs like whipworms and tapeworms. So we're going to take a little bit of stool here, about 2 grams. And then we are going to take our Sheether's solution, about 30 cc's of that. And then we are going to mix this up really well. And then we are going to use a gauze square to strain it into our tube. And you want to leave about 1 centimeter from the top. You don't want to fill it all the way up. And we are going to centrifuge it at about 1300 RPM for 5 minutes. And we're going to, you can see the little pellet in the bottom. We're going to set our tube here. We are going to add some more solution. And be careful not to overfill it. And then we are going to place a cover slip over this. And now we are going to let it float for 10 minutes. Our sample has been floating for 10 minutes now. So I'm going to take a glass slide here and gently remove my cover slip. Place it on my slide, and now I am ready to look at this under the microscope. I'm going to be performing a fecal sedimentation on ACE's stool. So fecal sedimentations are typically used on large animal parasites because their eggs are too heavy for flotation. So we're going to take about 2 grams of stool here. To fill our cup with tap water. We are going to mix this thoroughly. We are going to use a gauze square to strain it into our tube. And then we are going to place this in the centrifuge for 5 minutes. until it's done. Our sample is done here in the centrifuge. You can see we've got our little pellet in the bottom. And we are going to draw off all the excess here. And you want to be careful not to disturb the pellet in the bottom. And then we are going to place that on a glass slide. You're just going to get a little bit of your sample here. And place a cover slip over it. And then you are ready to look at it under the microscope. So I'm going to be demonstrating how to get a free catch urine sample. So we actually use these plastic ladles. Best to get a first morning urine sample, and you also want to try to get a midstream sample because there's less contamination that way. So we're going to see if Mr. Riley will go to the bathroom for us. So he's urinating. I let him go a little bit before I started to collect. Use this syringe here to collect my sample. And then any of the excess, I'm going to just dump out. And then I'm going to pour it into my tube. And now we have a voided free catch sample. His sample is yellow and appears to be pretty clear. So we've got Henry here, and Henry has been having some ongoing urinary issues. So Dr. Menzik would like a sterile urine sample today, which we'll be obtaining through cystocentesis. So Rebecca here is going to put him in lateral recumbency for me, and I am going to be using the palpation and isolation method. You can also do a blind stick, where you're basically inserting the needle in the area that the bladder should be. You can also do an ultrasound guided stick, where you actually use an ultrasound, locate the bladder, and then do a cystocentesis. So I'm just going to palpate his bladder here, some alcohol here. And you want to be careful, go straight in. Do not redirect your needle while you're in, because you can actually damage things. So we've got our sample here, and you can see that it's yellow in color, looks pretty clear. And then we are going to put on a sterile needle to transfer the sample. And we do this to ensure that the sample stays sterile. And now we have our sterile urine sample. So we are going to be placing a urinary catheter on Bingo, and we have him in left lateral recumbency. You can either keep them in a lateral recumbency or you can put them in dorsal recumbency using like a B trough or something like that in order to place your urinary catheter. We have Bingo here. We're going to be getting a sterile urine sample on him today for culture. We're going to be using a red rubber catheter. That is one of the types of catheters that we use here. Another would be the polypropylene tomcat catheter that we would use for a male cat. And then another option would be an indwelling Foley catheter. The indwelling Foley catheter typically used for a patient that had trauma to its urethra, has a urethral obstruction, something like that. So I'm going to go ahead and open some of this so we remain sterile. I'm going to open this here. And this is a sterile bottle of lube. So we're going to pull off the little tab here. And I'm going to go ahead and squirt some of this on here for my catheter. And this is I'm going to use to clean the tip of his penis. And this is a sterile sterile syringe here. And then I'm going to go ahead and open my catheter as well. Before I do that though, I'm going to go ahead and measure. So typically, I'm going to put his leg down for just a second. So from the tip of his penis around up to, backwards here, from the tip of his penis up to his bladder. I'm going to go ahead and open my catheter. And put on my sterile gloves. Alright, and I'm going to have Rebecca extrude the penis for me. It's okay, Bingo. Alright, okay.
Good boy.
And then I'm going to use the chlorhexidine solution to clean the tip here. Saline flush to rinse the tip off. And then I'm going to remove my catheter and put it in the sterile lube. And then I'm going to place my catheter here. There we go. Going to feed it. So as you can see, we've got urine, so we're going to let the first little bit run out before putting on our catheter, on our syringe here. And now we have a sterile urine sample. I carefully removed the urinary catheter from Bingo so as to not cause any trauma to his urethra. As I stated during the collection process, we did let the first few milliliters of urine run out. That was to help avoid contamination with the urine sample from placing the urinary catheter through the distal urethra. And as you can see, I've got his samples here. It is a dark yellow, but it is clear. We've got Henry here, and we are going to be doing an ear cytology on him today. He has been scratching at his ears, and we have already ruled out ear mites. So we're going to take our samples here. So we've just got a little swab. You can see there's a lot of debris in there. So we've got our right side here. And our left, and we actually break the tip, so it's an L for the left. And then I'm going to grab a slide. And I'm going to put the left sample next to the frosted side so I know it's the left side. And I'm just going to gently roll it on there. You just want to make sure it's not too thick on the slide. And our right. And now we are ready to stain this. I've got my ear cytology here. So first thing we're going to do is heat fix it. And wipe off the back of it here. And I'm going to use a clothespin, and I'm going to dip it in each of the Diff Quick stains. And we're going to do a total of 10. In each stain. And I'm going to rinse off the back of the slide here. And then to place it in the bibulous paper here to take off the excess water. Alright, so our slide is stained. And we're going to place it under the microscope here. You're going to start at the 4 times objective to get it focused. And move up to the 10 times. Then I'm going to add a drop of immersion oil here on each, the left and the right. And then I'm going to move to the 100 times magnification. And I've got it focused. And I'm going to look through both the left and the right side. Looks like on the left side he does have a fair amount of cocci bacteria present here. You want to make sure you look through both sides thoroughly. I'm going to move to the right ear now. And this is pretty much a mirror image of the other ear, seeing a good amount of cocci in this one as well. We're done. We're going to be doing a fungal culture on Batman. So we've got our DTM plate here, and then the way that you can take a sample is either with some sterile hemostats, which is what we're going to be using, or a toothbrush. With the hemostats, you want to make sure you're getting about 10 to 20 good hairs to put in your culture. And then if you want to look at the spot here, we're going to be taking a sample from. So he has had a spot of hair loss right here above his eye. So that's why he's here today, and the place we're going to be sampling. He doesn't have any other lesions, but when you're sampling a lesion, basically what you want to look for is around the periphery of the area, or if they have like a pustule or something, you want to take the hairs right from that spot. So we're going to take it on his lesion here. So Rebecca's going to hold him here for me, and we are going to take a sample. All right. We're going to go right around the edge here.
Oh no,
oh, it's okay.
No, baby.
Let's see if we can get a little bit more. It's okay, Batman. There we go. And we're going to take these now and basically push them into the culture. You don't want to bury them, you just want to make sure they're actually going into the culture. All right. And then we are going to keep this in our cabinet here where it's nice and dark. And then wait to see if we get any results. Just removed my DTM plate from the cabinet. It's been 21 days since we placed our specimen in the culture. So typically you're going to see the culture change red if dermatophytes were present. If you turn it over, we're not seeing anything. Usually dermatophyte colonies also tend to be fluffy and white. We're not seeing that either. But we're going to go ahead and set this up anyway, just to show how you would typically set that up if you were seeing something. So I'm going to take a slide here, and I got my lactophenol cotton blue stain. So I'm just going to put 1 drop here. And then I'm going to take a piece of tape. And if there was growth, you'd kind of basically go off the top of the growth. Since we don't have anything, I'm just going to go right to where I place my sample of the hair. And I'm going to put that over the stain. And you generally want to let this sit for about 5 to 10 minutes so the spores would soak up the stain. And microscopically, we would be looking for ringworm. I am not seeing anything microscopically here. As far as ringworm. So I would say that our culture is negative. We are going to be doing a skin scraping on Batman today. He has got a lesion on his head where he's got some hair loss and some scabbing. And we are concerned that he possibly has a mite infection. So we are going to be taking a sample here. This is his only lesion. Generally you want to take from multiple lesions if possible to get a better chance of getting the parasite. And so the best place to take your sample is going to be on the outer ring or outer edge of the lesion. So basically where your normal hair meets your lesion. So that's where we're going to be sampling from. So to prep your slide here, you've got your glass slide. I'm going to put a drop of mineral oil on it. And then you want to take a number 10 scalpel blade. And basically for him, we're worried about potentially Demodex. So this is going to be a deep scraping, and it basically depends on what parasite you're looking for, whether you want to do a deep scraping or a superficial scraping. So we're going to go right on the edge here. It's got a little lesion there. And basically you want to get to where it bleeds a little bit, and you can kind of squeeze it. Since we're looking for Demodex, they like to live down in the hair follicle. So in order to get a good sample, you have to produce a little bit of blood. I'm going to take our sample and put it in the mineral oil here. And now we are ready to go look at it under the microscope. I've got my sample here. I'm going to place a glass cover slip over it. And then we are going to look under the 4x objective to see if we got anything. Alright, so I can see the hairs here, and I can see the hair follicles, so definitely know we've got a good sample. And And you basically just want to systematically look through your slide. Make sure you don't miss anything. Alright, I've looked through the entire slide and I am not seeing any mites. I am going to be assisting Dr. Daryl Mensick today with a necropsy on a 3.5-year-old 57-pound collie mix. We typically do necropsies to either determine or confirm a cause of death. My protective equipment today will be a gown and gloves. I am also wearing scrubs. Dr. Mensick will also be wearing a gown and gloves. Here I have our instruments ready for necropsy. I've got different assortment of scissors, Metzenbaum and Mayo scissors, different assortment of hemostats, tissue forceps, a scalpel blade and handle, and then needle holders to close. We also have shears here for cutting the bone of the chest. I have all of the biopsy jars ready.
We're examining, sort of starting on the ventral aspect here. Nothing externally. Nothing here on the right side. Just examining the oral cavity. There is some paleness to the gums, which is expected post-mortemly. The jaw is fairly rigid at this time. Doesn't appear to be any obvious obstruction to the airway that we can tell from cursory exam of the oral cavity and the oral pharynx. There is a copious amount of gas in the stomach, probably a normal post-mortem change. There is some congestion noted in the spleen, which looks to be or appears to be normal size and texture, minus the different coloration there, again probably post-mortem. The left kidney looks normal size and shape. Right kidney also appears to be of normal size and shape. Omentum appears to be normal. Urinary bladder is empty. Colon is pale. The intestine appears to be relatively normal, just pale in color due to post-mortem change.
Yes, ma'am, be right up.
The lymph nodes there appear to be normal as well. The liver appears to be normal size and shape. The gallbladder looks particularly distended. Entering into the chest appears to still have a vacuum. All right, we will continue with the trimmers. Go to this side of the body too. You want to hold up this side? Oh Lord. This is most likely what is going on. Let me appears to be some hemorrhage in the lung fields that was there for whatever reason, we don't know, but lots of free fluid and blood. The lungs appeared to be deflated, but that could just be from loss of vacuum from when we had entered into the chest cavity. Let me go ahead and excise this other side. very similar hemorrhagic appearance to the lungs on this side too. Can I get the scalpel and then the scissors to follow? Yeah, some sort of pulmonary issue, almost certainly. We're going to start collecting tissue at this point. So we'll start with some lungs. So here's a section of lung that we'll have for collection. We will save the heart. This is the spleen. I'm going to go ahead and send off what looks to be like a congested portion of the spleen.
Got all of our samples here, which we will prepare for submission to pathology. I am going to be assisting Dr. Mensick with obtaining a vaginal swab. So I've got some gloves for her, some sterile swabs, some sterile flush, the glass slides, and some chlorhexidine solution to clean the vulva. So she's going to start by cleaning the area with some chlorhexidine. And she's going to rinse it with some sterile saline. And then she's got her sterile swabs here. And she's going to moisten it with some saline. And then she's going to insert it a little bit and then go to a 45-degree angle and insert it further. And do a couple rotations. And then she's going to roll it out on the slide. And now we are ready to set it up for cytology. So we just took our vaginal swab from Bella, so I'm getting ready to stain it, which you want to do immediately after taking the sample. You typically do vaginal swabs or vaginal cytology to determine the stage of estrus that they're in. Usually that's for breeding purposes, to see if they are ready to be bred. So we're going to start by immediately dipping in some methanol, excuse me. And you want to do it about 5 to 10 times. And then our red stain here, these are just Diff Quick stains. These other two, the eosinophilic and basophilic stains. And we just pour them into these little containers to decrease cross-contamination. And I'm just going to rinse it off a little bit here. And stick it in our fabulous paper. Dry it off a little bit. Go ahead and look at this here under the microscope. Get it focused first. So right off the bat, I see a parabasal cell. And I continue looking through the whole slide here. I'm seeing some more parabasal cells. And now also some intermediate cells. Lots of intermediate cells. Also seeing a few neutrophils. Not seeing any red blood cells. So going off the microscopic exam as well as her clinical presentation, I would determine that Bella is in anestrus. There are 4 stages of the canine estrus cycle. There is anestrus, proestrus, estrus, and diestrus. During anestrus, there are typically no behavioral changes or signs. Microscopically, you're typically seeing intermediate cells and parabasal cells. You don't normally see superficial cells, they're typically absent. You may or may not see red blood cells or neutrophils. During proestrus, the vulva is swollen and they produce a serosanguinous discharge from the vulva. Males are attracted to females during this stage of the cycle, but the female will not stand or accept them. You usually see a mixture of cells microscopically, usually intermediate cells, parabasal cells, and superficial epithelial cells. You generally see a large amount of red blood cells present, and then you also, pretty typical to see neutrophils as well as bacteria. During estrus, the female is now receptive to the male and will stand for coitus. There's typically a large blood flow to the area at this point, and microscopically you're going to see a predominance of superficial cells, which are almost all anuclear. You'll also see bacteria attached to those superficial cells. You usually don't see neutrophils at this point, and usually the red blood cells are minimal if present. During diestrus, the female dog is no longer receptive to the male dog. Microscopically, you're usually seeing a decline in the superficial cells, and then you're going to see a reappearance of the intermediate and parabasal cells. Microscopically, with this stage as well, you're going to see an abundance of debris. I'm going to be performing a cross-match agglutination test today, which is used to determine blood type matching for dogs and cats when considering a blood transfusion. A major cross-match consists of adding the recipient's serum to the donor's washed erythrocytes, and the minor cross-match consists of adding the donor's serum to the recipient's washed erythrocytes. The reason why we do the cross-match agglutination test is to make sure our donor and our recipient are compatible. This reduces the possibility of a transfusion reaction. So I've got my blood samples here. Oliver is my donor, and then Pudding is going to be the recipient. So I'm going to go ahead and centrifuge all of these. Once that is done, we can get started. The centrifuge is done, so I'm going to remove my samples here. So I'm going to take my lavender top tubes and set them aside. And I'm going to take my serum separators and make sure it's the appropriate. So Oliver, the donor. I'm going to take his serum and put it in my red top tube here. And then for Pudding, the recipient, I'm going to do the same thing. I'm ready to begin the erythrocyte washing. So we're going to do this for both the recipient and the donor. So the donor, Oliver. going to draw off the plasma and discard it. And then I'm going to take 1 to 2 drops of the packed red blood cells and put it in my non-additive tube. And then I'm going to fill the rest of the tube with 0.9% sodium chloride. And then I'm going to do the same thing for the recipient pudding. And draw the plasma off for him as well. And then you want to get 1 to 2 drops of the packed red blood cells and put it in your non-additive tube. And then you're going to fill the rest of the tube up with saline. And then I'm going to take both of these samples and just gently invert them. And I'm going to place them back into the centrifuge for 1 minute at about 3,400 RPM. And I'm going to repeat that at least 2 additional times to complete the erythrocyte washing. I have finished the 3rd and final erythrocyte wash. So I'm going to remove my tubes from the centrifuge. So I've got Oliver, our donor, here. So I'm going to, so one way that you can tell that the erythrocytes are good and washed is that the supernatant is actually clear and colorless. So I'm going to decant this off. And then I'm going to make a 2% erythrocyte solution. So I'm going to draw up 0.02 milliliters of the packed red blood cells. About 0.02. I'm going to put that in my new clean non-additive tube. And I'm going to add 0.98 cc's of saline. I'm going to set that one aside. And then I'm going to do the same for pudding, the recipient. So the supernatant for this is clear as well. I'm going to decant that. Clean non-additive tube. I'm going to draw up 0.02 of the packed red blood cells from this sample as well. ready to proceed with testing. I'm ready to set up the major cross match. So I've got a fresh test tube here. I'm going to take 2 drops of the recipient serum. And then 2 drops of the donor suspension. Okay, so I've got our major cross match there. I'm ready to set up the minor cross match. So I've got a clean tube here. And I'm going to take 2 drops of the donor serum. And add 2 drops of the recipient's suspension. And then next I'm going to set up my controls. I'm going to make a control for both the donor and the recipient. So I've got a fresh test tube here. This is the donor control, so I'm going to take 2 drops of the donor serum. And add 2 drops of the erythrocyte suspension. And then I'm going to do the same thing for the recipient. I'm going to take 2 drops of the recipient's serum. And add 2 drops of the recipient suspension. And now I am ready to check for autoagglutination. I've got both my major and minor cross match and both of my controls, my donor control and my recipient control. I'm just going to gently mix them, and then I'm going to let them sit here in the rack and incubate for 30 minutes before we test for autoagglutination. It has been 30 minutes. I've allowed my major and minor cross match as well as my donor and recipient controls to incubate at room temperature for 30 minutes. So I'm going to go ahead and centrifuge all of them. I'm going to centrifuge them for 1 minute at 3,400 RPM. So my major and minor cross match as well as my donor and recipient controls have been spinning for 1 minute and have completed. So I'm going to remove these are the major and minor, and I don't see any obvious signs of agglutination here. And then the donor and recipient controls, don't see any obvious signs of agglutination here either. So I'm going to take a drop from the minor, and we are going to check under the microscope for each of these to see if we see any agglutination microscopically. Major. Oops. control. And our recipient control. And I've got each of these labeled so there's no confusion, and I'm going to go ahead and take these over to the microscope. I am ready to check for agglutination, so I'm going to start with the controls. The donor control here. Okay, so I can see all my red blood cells, and there is no agglutination present here with the donor control. They're all moving about freely. I'm going to check the recipient control. And same thing here. Red blood cells are moving about freely. No agglutination present. I'm going to check my major cross match. Same thing here. Red blood cells are moving about freely. Not seeing any agglutination present. And going to check the minor cross match next. Same thing here. Red blood cells are all moving about freely. Not seeing any agglutination whatsoever. So after reviewing all of the slides, it would seem that they are compatible. Our donor, Oliver, is compatible with our recipient, Pudding. So we're going to go ahead and get a sample from Oliver to do a blood transfusion for Pudding.